occupational health. Now we are going to discuss what are the occupational hazards that a worker, an industrial worker may be exposed in the occupational environment. What is a hazard? Hazard is anything with the potential to cause harm, can be to animals or man. A hazard is anything with the potential to cause harm. That is the definition of a hazard in occupational safety and health. What are the occupational hazards a man, a worker is exposed in his environment? We will discuss about the different types of occupational hazards a person, a worker may be exposed. It can be classified into different types. The occupational hazards can be either physical hazards, chemical hazards, biological hazards, mechanical hazards, psychosocial hazards, behavioral hazards, or ergonomic hazard. This is the classification under which different types of occupational hazards comes. So first of all, we will discuss about physical hazards. What are the physical hazards a man may be exposed in his environment? Can be due to heat or cold, occupational hazards due to light and noise. There can be occupational hazards due to noise. There can be occupational hazards due to vibration. There can be hazards due to ultraviolet radiation, hazards due to ionizing radiations. So in an environment in which the worker is doing his job, he may be exposed to different his physical hazards depending upon the type of his job. Heat. If we talk about heat, in some environments, the worker may be exposed to high temperature or low temperature. So most of the time, the hazard can be due to the direct heat exposure to which the worker is exposed, which can lead to burns, heat exhaustion, heat stroke, heat cramps, there can be heat syncope, heat hyperpyrexia, prickly heat, etc. And sometimes there can be indirect effects due to temperature also. The indirect effects due to high temperature or heat can be decreased efficiency, increased fatigue, and high accident rates. So these are the important hazards a worker can have if he is exposed to high temperature. Many industries, there will be some places where there is more hot machines are working. Hot spots may be there. Ovens, furnaces, etc. will be there, which can radiate the heat. And this radiant heat is one of the problems in many industries. So those people who are working nearby this area can have health problems. Also, it can be due to heat stagnation, especially in some industries like jute industries, cotton, textile industries, and all those things. So this high temperature can lead to many health problems. So the physical conditions under which a person works is very stressful and impairs the health and efficiency of the workers. So it is very important to maintain a comfortable temperature in all industries or in places of work or occupational environment. So if we talk about the comfortable temperature, the comfort zone in our country is around 20 degrees Celsius to 27 degrees Celsius, so that the person can work efficiently and without much hazards. Also, there can be hazards when the temperature is very less also. That is, when we are exposed to low temperature or cold in certain industries, it can also lead to health hazards like chilblains, erythrocyanosis, immersion food, frostbite, and sometimes in general hypothermia also can occur due to low temperature when we work for long in low temperatures. So, temperature either high or low, both are hazardous to people. Light is another important thing that causes problems in people who work in certain industries. The workers sometimes are exposed to risk of poor illumination, very less light, and sometimes they may be exposed to high light also, excessive brightness. Both are not good for our health. Acute effects of poor illumination may be when the person has to work under low light for longer period. There can be eye strains. Person may be having headaches and eye pain, lacrimation, congestion around the cornea, and there can be fatigue of the eye fatigue also. And if a person is working for long in this condition, poor illumination, he can have chronic effects also, like minus nystagmus. So that is one condition where the health hazard occurs due to chronic exposure to illumination, low illumination. And also there can be blurring of vision and accidents. More accidents occur when when the light is more or less. Okay, then we have excessive brightness. So excessive brightness or glare is also associated with discomfort in persons who are working in such conditions. So there can be annoyance, visual fatigue, etc. can happen when there is when they are exposed to excessive light also. The intense direct glare can also result in blurring of vision, and most of the accidents happens because of this in some industries, some places, especially when the people are more aged or something like that. So there should be sufficient and good lighting, adequate lighting. That also natural lighting will be is preferred in the working environment, so that the person who are working can have a healthy life. Another important hazard in occupational environment is noise. Noise is a health hazard in many of the industries. We know that we have seen that we have we have heard the voices coming out from many industries, many machineries, and all those things. So it can be the effects on health can be either auditory effects or non-auditory effects. When a person is exposed to high noise, so it can even lead to permanent hearing loss or deafness, or that is occupational deafness, or temporary hearing loss. Sometimes there can be non-auditory effects also, which consists of either nervousness, sometimes increased fatigueness, efficiency, the work efficiency will be less, decreased efficiency. The persons cannot communicate effectively communication between people also not effective when the noise is high, so producing communication difficulty, that can also cause some problems. And annoyance, when we are exposed to high noise for more time, annoyance will be there. Our we have more psychosocial problems also because of these disturbances. And this most of the time, the effects, the auditory effects or non-auditory effects depends upon the duration of exposure, and sometimes on the intensity or the frequency of the sounds, all these things. And some individual susceptibility also, some persons may not have much problem, but some persons may be affected easily. So noise is one of the important occupational hazard in any of the industries. Then coming to vibration. So when a person is exposed to vibration for longer period of time, most most of the time it affects the hands and arms of the persons. So when they are exposed to a vibration for months or years, then the fine blood vessels of the fingers may become increasingly sensitive to spasm and leads to something called white fingers. And it can also cause some injury to the joints. That is, usually it affects the joints in the hands, elbows, and shoulders, in the hands and arms. Hands and arms. So it can cause injuries to joints in the hands, in the arms, like elbows and shoulders. The vibration is very important health hazard in some of the industries. Coming to the next type of hazard is ultraviolet radiation. It mainly affects the eyes. We have seen the arc welding. What happens there? So where they are exposed to ultraviolet radiation, what happens then? Can affect the eyes. Can affect the eyes. Can cause keratitis and intense conjunctivitis. So that is called welder's flash, welding. During the welding process, it is called welder's flash. These symptoms of the eyes, redness or pain, usually these things may disappear. Symptoms can be redness or congestion of eyes, and pain can occur. Usually these things can disappear if we are not exposed for longer period. So it can disappear in a few days with no permanent effect on the vision. So temporary, usually temporary. So it may not affect the deeper structures of the eye, but there can be some conjunctivitis, keratitis, and all. So that is usually very common in building, when where there is building processes going on. Then we have ionizing radiation. Many workers may be exposed to ionizing radiations, uh, like X-rays, radioisotopes, etc. So the maximum permissible level is for radioactivity is 5 rem per year. Maximum permissible level of the occupational exposure is 5 rem per year. So that is for radiological, that is for the whole body. So the important isotopes usually we come in contact with the cobalt 60 and phosphorus and all those things. And certain tissues such as bone marrow may be more sensitive to ionizing radiations. And there can be many hazards, genetic changes, congenital malformations, cancers. It can lead to leukemia. Sometimes it can lead to ulceration, sterility, depilation. In extreme cases, that can occur. Aplastic anemia, pancytopenia. All those things can occur due to constant exposure to ionizing radiation. So, for all workers who are working with in X-ray departments or working with radioisotopes, we have to reduce the exposure to the permissible levels. Maximum permissible level is 5 rem per year for the whole body. So we have to take measures to